Welcome back, you guys, to another video on how you can use virtual reality for physical therapy. Today we're talking about how you can reduce VR motion sickness for patients. So VR motion sickness is defined as when a patient has been exposed to a virtual environment that they experience symptoms similar to normal motion sickness. And there's nothing worse that turns a new VR user off more than when they get dizzy when they actually try it. I should of course say that it's a very small percentage of people who have very strong reactions to this, and the people who have strong reactions, they will react almost immediately when getting into VR, and that's like a very easy screening process. Just put them into the normal VR experience and see if they actually react. Of course, you want to reduce VR sickness, but you can also use it as a challenge to the patient's vestibular system. So if you actually see that there's a patient who has problems with balance and you want to challenge that, you can use a VR experience to slowly expand their tolerance to vestibular stimuli. What we have is that we can actually, in some of our software, we can actually just change the speed of the experience. So if we see a patient who's very affected by it, we can actually change the speed slower, so the vestibular stimuli is actually lower. You can even ask before you start the experience, have you had issues with car sickness or motion sickness? And some people, if they report that they get motion sick by just watching a screen, VR is something that you should try, but there's a high probability that they will actually have a problem, so be aware. The first thing you should do is choose a stationary VR game. There's nothing that induces VR motion sickness more than when the patient is actually moving, so like a driving game, a flying game, a roller coaster game. The bigger the difference in movement between the virtual experience and the actual experience the body is having, the greater chance there is of motion sickness. The second thing you should think about is, from a hardware perspective, the higher frame rate that a headset has, the more pictures the eyes are receiving. This means the more data and the less likely that the vestibular system is going to be confused. So two recommendations I can make there is the Vive, the HTC Vive, and the Oculus Rift, which both run at 90 frames a second. This seems to be the sweet spot for the best experiences. When you start using things like mobile VR, which are running 60 Hertz, it's much easier to get motion sick. We are very much interested in what's going to happen, for example, with the Oculus Quest. It's going to be running 72 Hertz, and how much motion sickness that's going to be associated to this is very interesting, because as developers we are very interested in seeing what the Oculus Quest is actually going to have to offer. Wink wink, I've had a little sneak peek and it's kind of awesome, but I haven't tried any games that are actually moving. On a side note to that, the new headsets that are coming out have the possibility to actually drive 120 Hertz displays, so this is also going to be a step forward in reducing VR motion sickness, because the higher frame rate, the lower the incidence of people actually getting VR motion sick. So the next thing you should think about is actually, if you're running it off a phone or a computer, performance actually matters. You need a powerful enough computer or phone to actually drive the amount of frames that you want. You would ideally like it to be at a steady 90 FPS. And if you don't have a computer that's powerful enough and you switch environments or the program becomes more demanding, you're going to have a dip in frame rate. And if a dip in frame rate happens while you're actually moving, this is going to be a problem for the experience. Fourth thing you can do is to start with small experiences and then slowly step up the dose. Usually people will respond better to slowly stepping up the activities and actually getting into it. And that's why just make common sense, just like in physical therapy, that you use small doses to start with, see if the patient reacts positively, and then you slowly step it up. There's also some indications that using natural locomotion, so for example, moving your hands or lifting your feet while you're actually being propelled in the virtual environment, has an effect on the amount of motion sickness that people will experience. So that's something you might want to experiment with. Lastly, there are some hardware products that are actually coming. There's a product which actually uses small vibrations and bone conduction to facilitate or stimulate the inner ear. It creates a kind of white noise, so it kind of calms the vestibular system. They're doing some initial tests at, I think Jaguar was one of the car companies who were actually using it, and the initial results are, from what they say, they are very promising, but there are no like RCT studies or clinical trials that says that this is the end-all thing to actually end VR motion sickness. So let's keep an eye on these guys. Thank you guys for watching. I'd like to know what the most VR sickness inducing experience you have tried or you've actually tried with patients, so maybe we can get some best practice going so we can steer clear of some of these. As usual, thank you guys for watching. If you want to know more about physical therapy and virtual reality, do hit that like button, hit that follow button, that little bell for notifications. It's a very easy way to support us. Until next time, see you soon.